Hey everyone, we've got another heart today. This is number 48 in our collection, and we'll do a quick kind of teaser or preview of this heart in brief, and then go through the actual anatomy. So unfortunately the lungs are a little chopped up here, but we do see that the lungs and the airway are still attached to this specimen. And both the left and the right lung do have 3 lobes. And the tracheobronchial angles do appear relatively equal and identical. So it appears like we're going to be dealing with right isomerism. And so since we expect the heart to be relatively abnormal and congenitally malformed, we'll go ahead and just kind of put everything in place, get ourselves oriented, and look at the anatomy sequentially. So here's the heart, here's the airway, here's the left lung, here's the right lung, anterior surface towards the screen, posterior surface towards the turntable, left over here, right over here, superior head up here, inferior or legs down here. Now, we'll go ahead and look for some atrial appendages. And here's one atrial appendage that looks pretty broad-based, triangular or pyramidal in shape. So we'll go ahead and open up the heart there. And we find that this right-sided atrial appendage leads to what appears to be a morphologic right atrium with pectinate muscles that spill outside the confines of the appendage. And we also see that there's essentially a common atrium with the left-sided atrium right back here. So why don't we go over to this left-sided atrium and take a look at that. So both the left and right-sided atrium appear to be morphologically right. There's a common atrioventricular junction here. So here's the left-sided morphologic right atrium over here going towards inside the screen. And then here's the right-sided morphologic right atrium. And here is a common atrioventricular junction guarded by a common atrioventricular valve. Now we can try to identify, if we can, the superior caval veins. And here's a structure that appears to be a superior caval vein, so we'll go ahead and probe that. And this opens up into the right-sided morphologic right atrium. So we do have a right-sided superior caval vein. And we'll go ahead and see if we can find a left-sided superior caval vein as well. And perhaps this is one. And so here is a left-sided superior caval vein as well. So we do have bilateral superior caval veins. Here's the left superior caval vein here. And then here is the right superior caval vein here. So you can now see the right-sided morphologic right atrium here with my right hand moving. And then here is the left-sided morphologic left atrium over here. And you can see that it's essentially a common atrium, but there are pectinate muscles that spill outside the confines of the appendage on both sides, consistent with right isomerism. And remember that the morphology of the atria are best defined by the pectinate muscles rather than the external appearance of the appendages themselves, as those can change because of hemodynamic change or because of surgical manipulation. So we've seen that there is a common atrioventricular junction. It opens up into what appears to be a solitary indeterminate ventricle. There doesn't appear to be any second ventricular cavity. This opens up into the same cavity we've been looking at here. So a solitary indeterminate ventricle. And we can't assign this any sort of sidedness because since there isn't truly a ventricular septum, since there isn't a second cavity, we can't actually use our handedness rule. So here is that single indeterminate ventricle. And we see that there is a great vessel here. It is guarded by an arterial valve with 3 leaflets, 1, 2, 3, with 3 sinuses, 1, 2, and 3. There is a coronary artery arising from this sinus here, consistent with a morphologic aortic valve. And you can see that this aortic valve is entirely supported by muscle. There is no fibrous continuity between this arterial valve, which is the aortic valve, and this atrioventricular valve here. Here is the ascending aorta, here's the transverse arch, and then here's the descending aorta here. We haven't seen the second outflow tract, so why don't we go ahead and try to find a pulmonary trunk. This is getting all tangled up, I'm sorry, and here we go. When we look from the posterior aspect of this heart, we do find a second great vessel here that is much smaller. Here is the pulmonary trunk that leads to the branch pulmonary arteries. Which are also hypoplastic. So here's the pulmonary trunk. Here are the branch pulmonary arteries. And if we try to probe backwards, the probe really doesn't go anywhere. So this is pulmonary atresia. And there's only one indeterminate ventricle. So technically this would still be double outlet, indeterminate ventricle with pulmonary atresia. And then last but not least, the pulmonary veins. And we can see a number of pulmonary veins that seem to come to a confluence here and then drain into what appears to be the left-sided morphologic right atrium. So here is the left-sided morphologic right atrium. If we put our probe through here, it goes into this confluence here where all the pulmonary veins seem to drain into, and then they drain into the left-sided morphologic right atrium. So here are the pulmonary veins draining into a confluence, which then drains into the left-sided morphologic right atrium. And once again, essentially a common atrium here with a common atrioventricular junction. And so a heart with right isomerism, with bilaterally 3-lobed or trilobed lungs, and equal tracheobronchial angles on both sides here. A right-sided morphologic right atrium, a left-sided morphologic right atrium, bilateral superior caval veins, a common atrioventricular valve, a solitary indeterminate ventricle with an aorta of good size, double outlet, but with pulmonary atresia, with a hypoplastic pulmonary trunk and branch pulmonary arteries.